welcome back to On the Couch with Nikki, where I bring you experts for expats. This episode is kindly brought to you by Expat Dental, conveniently located in Novena, just above the MRT. So, who's on the couch with me today? It's time to talk about the minefield of options available for aesthetic treatments. Botox, fillers, fat freezing. The mind boggles with the options and it's just really confusing. I have with me Dr. Sylvia Ramirez, the Medical and Scientific Director at Cutis Medical Laser Clinics, to help demystify this intriguing topic.
When a person is making a choice as to which clinic to go to, there are probably a few questions to ask. The first is, does the doctor have a lot of experience administering the treatment? And this is important not just for Botox, but for fillers, and both are very technique dependent.
Yes.
How the doctor does it does make a difference in terms of the outcome. The second is make sure that that particular clinic has US FDA or CE mark treatments only.
Fillers. When do people use fillers?
When we think about fillers, as the term suggests, it's meant to replace where volume has been lost.
Where we start to sink, or we look a
Where
little
we
bit
start to
sunken.
sink. So we lose volume in a very predictable way. So we typically will lose it around the eyes first, and then the cheek area. What we know is the middle of our face is mobile. So as we get older, it tends to move down and to the center. So we then need to give better support on the outside to the nasolabial fold and to a certain extent the jowls.
It's quite structural, like a building.
It's exactly correct. It's doing the foundation first.
Okay.
Our typical patient would be an expatriate patient over the age of 30. The most common concerns would be expression lines, so that's managed with Botox. We do lose collagen as we get older, so we need to build that collagen. And so collagen building treatments are also important. An example is Ultherapy. This is an ultrasound treatment. So it's the deepest, non-invasive way without a downtime to create a lifting on the face because it builds collagen up to a year after the treatment. We also do pigmentation treatments, but we also have hormonal pigmentation. That's the patchy pigmentation we see like masks on the face. When we hit menopause, these pigments can start to darken.
Eyes, hooded eyes. As women, we age. Most women are going to have the problem of droopy, saggy eyelids. Is there something that can be done for that?
If a person, when they smile, crinkles the eyes and pulls things down, pulls the eyebrow down, a little bit of botulinum toxin could prevent that from happening over time and worsening. Second, there's a skin component often. So the skin component is because of loss of collagen. So you may want to consider treatments like Ultherapy or even placement of threads to improve the collagen in the area above the eye.
Okay.
Right? Third, often there's a volume component. So if you look at the face, we often hollow in our temples as we get older. When we hollow in the temple, there's less support for the brow and upper eyelid. And so placement of fillers in the temple can give better support to the draping of the eyelid.
Can you do anything for the neck?
Yeah, absolutely.
Some people just have a predisposition to that as well. I mean, with all these things, there's the aging part of it. Somebody is older and we depreciate. And then there's genetics, I would think, as well. That
Absolutely.
there are just some things you inherit even from a young age that you might want fixed.
That's right.
Yeah.
Now, no question, you could have a very slim individual but has a fullness here, right? So there are a couple of components to that. One, we assess, is it fat deposition? If that's the case, we would think about fat reduction treatments. If it is more laxity in an older person, we would think more about lifting treatments, collagen building, like Ultherapy, and sometimes with the use of what we call threads. So threads are bioabsorbable filaments that are inserted, very similar to how we do fillers, to create a tension and to reposition the skin.
So that also lifts.
That's also
So
lifts.
you could use it for gels
Use
as
it
well.
for gels as well.
Some people think that if they come in to inquire more about the procedures, that they're thrown into a chair and they do it then and there. For some people who just want to find out more about it, can they come in and just inquire?
Oh, absolutely. In fact, I encourage that.
Yeah.
Especially if a person has never had any experience with any procedure. I want people to come in for consultation, understand, and walk out. Think about things first. Do not ever feel pressured to do the treatment. Ask questions, as many as you'd like.
Now I have to ask you the hard-hitting question. There are people walking around that look ridiculous. They look like freaks, almost clown-like. How does that happen? Because I know that can scare a lot of people off from even embarking upon this sort of treatment, and it doesn't have to be that way. I get it done. I'm very happy coming to you.
Thank you.
Why do some people look so out of proportion?
I think it is true that even a 1 to 2 millimeter over treatment of a part of the face can look unnatural and unbalanced. You need to have a good discussion with the physician because the philosophy has to be similar. Most of our patients look for what I call quiet rejuvenation. They just want to look fresher,
Yes.
maybe a couple of years younger, but they are generally happy with how they look. That type of person, you want to be careful, administer treatment slowly, in slow doses, because you can always add.
Yes.
There are, on the other hand, patients who want extreme changes. And there may be other physicians who are better at administering those types of results.
So if somebody came in and just had a long shopping list of what they wanted and you thought that's going to look ridiculous, would you still do it?
No, an individual, a patient should never ever feel pressured or rushed into a treatment. This is an elective procedure. These are elective procedures.
Yeah.
The changes have happened over years. The goal is not to reverse it instantly.
Let's talk about the rest of the body. I've heard a lot at the moment about fat freezing. What is fat freezing? Does it work? When do you use it?
Fat freezing is, of course, effective, and it's been shown in all the clinical studies to show a 15 to 25% fat reduction for the pocket of fat that is treated. Okay, so what happens is the fat pocket, so for example, the stomach area, is subjected to a certain temperature.
Yep.
That temperature, the cold, triggers a state of death of the fat cells.
Wow.
Over time,
I love
right?
that.
It is not a replacement for diet and exercise. It treats pinchable fat, so what we call subcutaneous fat, spot fat reduction. As women, by nature, because of our hormones, our hips and legs are resistant to exercise. That's just the way things are.
Yeah.
Cryolipolysis or fat freezing allows us to target these pockets of fat to gradually reduce them over time.
Is there an age that people should start thinking about this? Is this a prevention better than cure approach, or is this, no, you really should just wait till the aging process starts and then start doing it?
There's no judgment as to whether you're too young, as long to me as a person is a thinking adult and
Yes.
makes the decision on their own, that you understand the motivations, you know they don't expect to win a boyfriend if they have better lips.
Yeah.
You part of the consultation process is actually understanding the psychology and the
I was
motivation.
going to say, you need to be a therapist as well. You might need a black couch in there for
You
people
need
to
to
lie
really-
down on and
You
tell
need to
their story.
understand. Yeah, absolutely.
Thank you so much for coming in today. I'm sure you've answered a lot of people's questions. I know you've answered a lot of mine. It's been wonderful. Thank you. It's okay to want to be the best you that you can be. If there's areas of your face or your body that you want to improve upon or that you're not happy with, that's okay. Go and get a consultation. Find out what options are available to you. These procedures don't have to be invasive. They don't have to be painful. There's a plethora of options available. Go to Cutis Medical Laser Clinics. They're in Pacific Plaza. Dr. Ramirez will give you honest feedback and advice for you to go home and process and make your decision from there. Thanks everyone. I'll see you next time.